What's the natural next step? Vaccinations. So today, my presentation will focus on some general information: safety with the vaccine, vaccine distribution, what to expect, and what are the types of vaccines that are being administered now. And I'm probably going to call on Deacon and Anne at some point. Feel free to chime in. So we'll start out with safety. Safety is a top priority, and it's a top priority in the development of the vaccine, in addition to ongoing after the vaccine is administered. And we know that safety is key because the FDA, the U.S. Food and Drug Administration, has granted what is called emergency use and authorization for 2 vaccines. And they have shown that these vaccines are safe and effective. And that comes from data from real people, from clinical trials, and from the manufacturers. So we can rest assured that those are findings that can comfort us. The data really shows that the potential harm from the vaccine or the benefits from the vaccine outweigh the potential harm that we could have from the virus. We know that this virus is very contagious and very dangerous. So the vaccination will help us. It'll help protect us from getting COVID. I want to tell you that it's not going to give us COVID because it does not have a live virus in it. That doesn't mean we might get side effects, but it will not give us COVID. And I've heard people say in the past, I had that flu vaccine and it gave me the flu. Well, you know what? That's not possible because the flu vaccine doesn't have a live virus in it either. And the experts are saying to us that they believe that this vaccine will keep us from getting seriously ill. It'll protect us. It'll protect those mostly at risk, those around us. Studies continue to be done. We just don't know enough about it, but there's more to come. So I'm going to talk more about how that vaccine protects us a little later. So there are recommendations in prioritizing who should get the vaccine. And they come from the Centers for Disease Control and from New Jersey Department of Health. But they really all started with the Centers for Disease Control. And then that information filters down to the state level because every state is responsible for their vaccination plan. So you probably heard about many of these guidelines: 1A, 1B, 1C, 2, where do you fit in? Can you get the virus? And those were all set up first by the Centers for Disease Control. So now we're in New Jersey. So what's happening? New Jersey has really moved pretty quickly through these phases. And I'm going to tell you in a minute who can be vaccinated in New Jersey. And the New Jersey goal is that 70% of all individuals will be vaccinated in 6 months. So I looked up some numbers yesterday so I could give them to you. So far in New Jersey, over 481 first doses have been given. 481,000 first doses have been given, and over 69,000 second doses have been given. Seems like a lot, but then it doesn't seem like a lot because I think there are about over 6 million individuals in New Jersey who are age 18 and over. And New Jersey started in December with the vaccinations. They started first with healthcare workers, they moved on to law enforcement and others. And they moved through these phases pretty quickly. And all the information I'm giving you today is from credible sources, from the Centers for Disease Control and from the New Jersey Department of Health. So who can be vaccinated right now? Well, as of January 22nd, which was our latest update, and we check all the time, healthcare professionals, long-term care residents, staff, congregate living individuals, first responders, everyone 65 and over. And that just opened up more recently. In addition, individuals who are 18 to 64 with certain diagnoses, and there's a whole grid on who they are. So if we have some youngsters in the group out there, which I think we do, some of you look younger than me. If you have any underlying conditions, I'll just mention a few: cancer, kidney disease, COPD, Down syndrome, obesity, and others. And smokers are in that. Somebody told me the other day, that's just not fair that those smokers get it, but I don't know what to say about that. I'm not going to discriminate. So next, I want to talk about New Jersey vaccination plan. Where can you get vaccinated and how do you sign up? So New Jersey is partnering with a number of organizations. They're partnering with Rite Aid to vaccinate home care and hospice staff, CVS and Walgreens. They're vaccinating the long-term care residents first and some senior housing. And then when they are done, CVS and Walgreens expect to go on to, to the rest of us. Walmart is working with individuals who are intellectually and developmentally disabled in group homes. And then there are the mega sites. There are 6 mega sites in New Jersey, and you don't have to take notes if you need this information. Anna's going to provide that a little later. In our general area, 3 of the sites are Atlantic County Convention Center, Atlantic City. Burlington County is the Morristown Mall. Gloucester County, Rowan College in Sewell. Those are the 3 that are open. And there are various ways to get to those sites. And then we have the designated vaccination sites. So I'm just going to hold this up for a minute. There are 123, at least 123 vaccination sites that are available in New Jersey. And I'm going to tell you a little bit about some of them. I'm going to give you some examples. Some of them are health departments, health centers. We talked about the mega sites. They're listed on here as well. Some hospitals are working with the sites. For example, I belong to My Cooper, and I went into My Cooper and I scheduled my appointment, which is at the Camden County Community College. I believe Virtua points individuals to the Morristown Mall, if I'm not mistaken. Mm-hmm. So some of the hospitals may be involved in the scheduling and the administration, and then but they are not doing it necessarily at the hospital setting. I went online and I saw that Acme is coming in the future, but you can pre-register now for Acme, but I'm not sure when that will happen. And then we have ShopRite. ShopRite has many sites. They're all listed here. And I'm going to give you a couple tricks because we have helped to register ourselves, our staff. I'm a nurse and we have a team of nurses and social workers. And so we have a little bit of experience with some of the sites, and we want to gain more information as we go on. So for example, on the ShopRites, that's an online application, or you can download the app, I should say, or go onto the website and sign up. A little trick with that is that if you are signing up, if you put in your home zip code, it'll only give you 10 miles. And if you're able to, the ShopRites that are available within 10 miles, if you're able to travel further, the best thing to do is to put in the ShopRite zip code from this list so you can see what's available. Now, my experience has been there hasn't been any available lately. And you have had some experience with a couple of the sites, I believe.
Yeah, like Mimi said about the ShopRites, there is an app that you can download on your phone, and it's the Pharmacy ShopRite app. Mm-hmm. Also, for if you have a doctor associated with the My Cooper or Virtua or even Inspira, you could sign up under those websites. ShopRite, The other one was CamCare. Mimi, did you mention that one?
Yes, well, I was going to go into some more detail there, but you've been to the ShopRites. Maybe you can
Yes.
talk about what it's like there.
The ShopRite, I felt very safe there. I scheduled my appointment a few weeks ago. I was able to get my first shot in January, and they gave me a follow-up date as I was there. Before I left, they let me sit there for 15 minutes after I got the first dose. And then afterwards, they gave me a card with an appointment for the second dose. So I thought it was administered very professionally. I felt safe and confident when I left there that everything was done properly.
So typically, many of the sites you have to sign up online, but there are some that you can go and make a telephone call. So I'm going to go over that now. So how do you sign up? We have the New Jersey State site under the Department of Health. You can go in there and you don't have to take notes. Ann's going to provide this. You can go to the New Jersey COVID call center and we'll provide you with that number later. We called that number yesterday to test it out and they said they will be scheduling for the future, maybe later this week. Right now they're available to help people navigate the online registration. Okay, by telephone. Not all of the sites allow you to go on by telephone, but in Camden County, for example, we found a gem. It's called CamCare. It's a health center. And just yesterday afternoon, we signed up, I think, 5 people. And we're here to help you too. Just keep that in mind. We can help sign you up if you need assistance, either phone numbers, websites, any information, or help navigating to sign you up. So CamCare in Camden County is administering sites in Camden and in Clemington. And they ask you if you are in Camden County or Gloucester County. But I do not believe that they will take you if you're in another county.
Correct.
And they are scheduling now for the end of March and the beginning of April. And one thing that I really like about what I'm seeing now is that the vaccinations they're scheduling both vaccinations, your first one and your second one at the same time. So, but as I go through this list, there are some phone numbers for the county, but there are many, many that are websites. And you have to be persistent. That's what we've had to do. Right now, it's going to be difficult to walk in. One person told me they were able to go to a center and stand for 2 hours. That's not feasible for most people, but overall, I don't think that that's really available. And of course, we're here to help you. So supply is limited. I want to mention that. And it will increase as the manufacturers have more vaccines and more are approved. So we have 2 right now, and we have another one coming. So first, I want to talk, though, about what you can expect after getting the vaccination. So what are some of the side effects that occur? So the most common ones are pain and swelling in the site where you get the injection. And then some people get fever, chills, tiredness, headaches. Very few people experience a severe reaction. So some tips for you, just some simple things. Apply a clean, cool washcloth to your arm, exercise your arm, get the circulation going, drink plenty of fluids, don't constrict the area. When should you call the doctor? You should call the doctor if the redness or tenderness does not go away after about 24 hours. And if you have side effects that you're worried about or that don't go away after a few days. I want to mention that you are not going to test positive for COVID because you will not have COVID virus in your body. You will not be injected with it. You won't have it. But you may test positive for the antibody. And that would be expected because if your body is working, you're going to develop those antibodies. So if you have an antibody test, you could be positive. And cost is not an obstacle. The vaccines are paid for by taxpayers' monies. They're free. There may be an administration fee that is picked up by your insurance. So be sure you have your insurance card ready when you go for your vaccine or when you're scheduling. And if you don't have insurance, I'm sure that there will be accommodations in that. So what are the current vaccines? Pfizer and Moderna. And you've heard a lot on the news about Johnson & Johnson, which is a little bit of a different technology, and it's a one-shot, where Pfizer and Moderna are a two-shot vaccination. So what we're used to in vaccines in the past are pretty much vaccines that use an inactive germ or a weakened germ, and they make that into a solution into the vaccine, and it triggers an immune response. Those are many of the vaccines that we have taken, like the flu vaccine and others. So Moderna and Pfizer are using a technology which is called mRNA vaccine. So what is mRNA? It's messenger ribonucleic acid. It's a genetic material that contains instructions for making proteins in our body. So what happens is the manufacturers make a synthetic mRNA. So you get the shot and the mRNA goes into our cell and it instructs the cell to produce what's called a spike protein. And that's what's found on the COVID virus, on the surface of that, a spike protein. The body says, I don't recognize you, you don't belong here. So it starts to fight it and you get antibodies. And then later, if you're exposed to the virus, your body says, I'm going to destroy this before it causes an illness. So it's an antibody response and an immunity that develops. So as we look at these new technologies, some people might want to know, what is the Catholic perspective? Well, the U.S. Council of the Catholic bishops and the Vatican, sources say that it's morally permissible to get the vaccine. However, we do have freedom to choose whether we get it or we don't, but it is recommended that we take the vaccine for the common good of the people. So now I'd just like to mention a little bit about the two vaccines, Pfizer and Moderna. There are many similarities and some differences. Pfizer and Moderna are two shots. Pfizer, the shots are 21 days apart, and Moderna, they're 28. Pfizer is recommended for individuals 16 and over, Moderna is 18 and over. And Pfizer is 95% effective, where Moderna is over 94% effective. So they're both very effective vaccines. Who shouldn't get these mRNA vaccines? Well, let's start out with anyone who's had an allergic reaction to something called polyethylene glycol. That's PEG, and polysorbate, which is similar to something in the vaccine. And then we're going to talk about some other groups in a few minutes with the updated information. Usually if you have a response, as I mentioned, it's going to occur typically immediately. However, some allergic reactions could occur up to 4 hours. So what's the update on the latest information from the Centers for Disease Control as of January 21st? They recommend that you continue with the regular interval between the vaccines of 21 to 21 days, with a few exceptions. Pardon me. If you have to, there is a little bit of a window. You could take the vaccine 4 days earlier if needed. And then they're also saying regarding the second dose, they want you to follow the recommended interval, but if it's not possible, the second dose may be scheduled up to 6 weeks, 42 days after the first dose. Also, these doses are not interchangeable. If you get Pfizer first, you have to get the second shot Pfizer, Moderna and Moderna. You can't interchange them. And if you have another vaccination to get, you have to wait 14 days before or after. We don't know about boosters, no information at this time whether we're going to need additional boosters. And if you've had COVID, you should get the vaccine. If you have COVID right this minute, you should wait until you recover. And if you're quarantining, typically you would wait until after your quarantine, with the exception possibly of individuals in congregate settings and nursing homes. If you're immunocompromised, you should check with your doctor. Autoimmune disorders, there's not a lot of data, but check with your doctor. It's probably safe according to the information. There have been no cases of Guillain-Barré reported. There have been cases of Bell's palsy, which is a nerve condition that occurs. However, they're saying that the frequency is not above the expected general population. And then for those of you that might know about dermal fillers, which you can see that I haven't used, they are used to fill in wrinkles on your face. This is a new thing. You can have swelling near the injection site for that dermal filler, but it usually resolves. It's temporary. You may have to take steroids for that. So what about other precautions? If you've had a reaction to any vaccine or injectable medication, intravenous, subcutaneously, or intramuscular, it's a precaution. You should check with your doctor, but not necessarily a contraindicated in getting the vaccine. And you may want to see an allergist or immunologist according to the Centers for Disease Control. And it's also not recommended that you take an anti-fever or anti-pain medication prior to the shot. There's just not enough information on the impact on the antibody response. So as I begin to wrap up, I just want to say that vaccinations are a tool to help us stop this pandemic, but it's not everything. Right now, we have to continue the best practices of wearing a face mask, social distancing, avoiding crowds, washing our hands. It doesn't mean that we can stop wearing that mask. And it's so important that you get that second dose. So I just want to mention something about that. When does our immunity begin, and when are we immunized? Well, according to Pfizer and Moderna information, you start building immunity at about 12 days. And then between 7 and 14 days after the second shot, you should have total immunity, according to the research and information that is available. Again, that doesn't mean that you have to stop everything, and it doesn't mean that you can skip that second vaccination. So I want to open it up to Deacon Jerry and Ann. Is anything else you would like to add?
Deacon, did you want to add anything before I ask for questions and answers?
No, I think a great job, Mimi. Thank you for covering all those topics.
Oh, you're welcome.
It's good information for us all. So I don't really see anything to fill in. We can just maybe answer questions that people might have, because there's been a ton of questions being raised, mostly about access to it and be able to get them. So we'll be open for any questions anyone has.
Does anyone have any questions? Leslie, do you want to take yourself off mute?
Be off mute.
There you go.
So my question goes back to helping seniors and people who don't have computers to try to get them appointments. I'm a parish nurse at Christ Our Light, so we're trying to think of how we could help people. I know someone that got on, helped her friend get on, but the question is, if I was trying to help someone without a computer from my computer, would that generate any, I don't know, suspicious activity because I was trying to help or get multiple appointments? Or, I mean, does that come up or?
No, but we have some experience with doing applications for seniors and individuals who are disabled where you can't use the email more than once. So for Christ Our Light, which is in Cherry Hill, I would suggest CamCare. That's our go-to right now. And this is on the Department of Health. We can get this to you if you have this. CamCare offers vaccines in Camden and in Clemington. And they are scheduling the end of March to beginning of April. You can call, that's the best way. They don't even have on-site registration right now. But for Camden County, you have CamCare at 2 sites. You have Project Hope. Oh, well, let me back up. CamCare, we've registered so many people. Last week, I don't know, over 20, 30 or so last week at CamCare. It's been the place that you can get somebody to answer the phone. You might have to be persistent. Oh, and here, I don't know if I mentioned this yet, but they happen to be open on Saturday. I just thought, let me give it a try. So I was able to get 3 people scheduled Saturday, and then I text Ann, who called and had, I think, 3 more people.
Yes.
And then I found out they have evening hours tonight until 8 p.m. So that's just another added plus, okay? And I mean, they answered the phone on Saturday, I had no problem. Now during the week, it's a lot of waiting sometimes. We've experienced that. Also for Camden County, your population there in Cherry Hill, I have not tried the MRG Mount Ephraim site, but those are some that you can call.
Okay, thank you. And I know things change day to day, but my daughter's coworker in North Jersey a couple weeks ago got her appointment from Jackson, New Jersey. She's going down to Gloucester City. So I guess they're narrowing things down. At that point, they weren't, but here she's traveling like an hour and a half to get her vaccine.
Oh, my goodness.
Yeah.
Well, and back to the online registration. Here's another possibility. We've used this for applications. You can create a Gmail account for the individual and monitor it yourself.
Thank you.
Okay. You're welcome. But then, you know, if you get a bunch of them, you really have to be sure that you're in the right one.
Yeah.
It can
That
get,
too.
yeah, I know. I mean, because it's just a little awkward getting into those once you have a whole bunch of them.
Okay.
There's
I have
some
some,
of our little tricks.
Can I just add to that I was on a conference with the Camden County Department of Health this week. And
Yes.
if you use the Camden County site, it's the camdencounty.com/vaccine registration. You can get on that site and sign up. They promise what they're going to do this weekend is to go through that list and maybe move people up according to priorities. The schedule is so far out right now that they're going to take a look at that, because it's been basically first come, first serve. As you get in, you get on. But they are going to take a look at that and try to create some sense of priority by age and comorbidities and move certain people up in the class of 1A and trying to get them a little higher. So it may be worth a shot to look at that. Their mega site is at the Camden County College in Blackwood is their big site that they're using. But that's another avenue that you could use to try to get someone on. And don't be afraid about using another computer. You can just, as long as that person's on, just make sure that if you want them to get email notifications, that you put their email in and not yours. Or if you're going to use yours, then make sure they get the information once they're notified as to when to schedule an appointment.
okay.
And we're on the edge of Camden County near Christ Our Light. We have some people in Mount Laurel, which is Burlington County. So I don't know if that changes the situation.
I doubt it.
Okay.
They seem to be trying to cluster as many as they can in there. And I did point this out before, and I will say that if you have an appointment on any one of these websites or locations, and you do happen to get another appointment that's sooner, please go in and cancel your other appointment, because this is causing other problems. People are shifting around, oftentimes juggling and making more appointments closer, but they're not canceling their previous appointments, and they're taking up space for someone else to get on. So I just remind people to cancel if you have a new appointment.
Thank
I have
you.
a message that came in from Mary Jane Burke. I have the list, but all phone numbers or emails do not provide us with accessibility or the links. Mary Jane, are you there?
Yes,
Did you
yeah,
want to?
I'm also a parish nurse and
Hi.
also 66. Hi. I was hoping to be able to publish in our bulletin some helpful information, and we also have a monthly newsletter. I have not been able to connect in Atlantic County with the Atlantic County Health Department, with the ShopRites, with the CVSs, or with the Atlantic Care mega site, nor the FQHC. All of them are turning us away, saying that they do not have any vaccine, and appointments cannot be made at this time. I'm wondering then how, did we get any vaccines for South Jersey? And since that's a mega site, and if you know of anything that maybe behind the scenes I've missed.
Well, I had one of our staff call yesterday in Atlantic County. Scheduling's not available at the mega site. Yeah, I mean, you're pretty consistent. Sign up for updates at another mega site. You can pre-register. Okay, so, oh, I'm sorry, forgive me. Let me get Atlantic County. Forgive me. Okay, and I made a couple calls. No doses available at MedLink, no doses available. Yeah, at the Family Health Centers, no doses available. And I don't think I know anything else. What they're pointing you to is, I think Atlantic Care is pointing you to covidvaccine.nj.
Yes.
So I would do
did go.
that. I would definitely do that for your individuals and see. Yeah, and you said you did that already?
Yes, I did that. I'm pre-registered, so is my husband. We haven't heard anything about being able to go for our vaccines, but I also sent them an email, if it said if you're having issues. So I sent the
Good.
state an email. I don't know what else to do.
Well, I would recommend that you start calling the COVID line that I mentioned earlier,
Yes.
and Ann will give you that number
Mm-hmm.
afterwards. She'll send that out to everyone. I think that's one of your best bets. And also checking maybe other counties. I don't know about the individuals, though. Many people are not able to travel. That's a problem. So,
And Mimi, sometimes when you're doing going on the sites, try to go on the sites in off-peak hours.
mhm.
Later at night or earlier in the morning. Sometimes that has been successful for me too.
I'm really good at that.
Okay.
Yeah, and
Late at night, early in the morning. My husband actually came in the other day and said, honey, here's your phone. You have to call the New Jersey site.
yeah, and then, oh, and for Atlantic County, let's see, the ShopRites. Yeah, just be sure, put in the ShopRite zip codes
Yes.
for those towns. Okay,
Okay.
so for Atlantic County.
Wish us luck down south.
What's that?
Wish us luck down in the south.
Yeah, and I
well.
would do that, and I would call the COVID call center.
Okay.
Mhm.
That's been one of the biggest, obviously, frustrations was the distribution to counties. It really comes from the State Department of Health. New Jersey's responsible. They get their stash, so to speak, and then they have to distribute it to various counties. And the problem has been no one really knows what the formula is for how they're distributing it. Is it strictly based off population? Is it based off percentage of people who've already been vaccinated? Percentage of high risk group people? No one really knows. So a lot of counties are running out because the supply isn't there. There's other counties have an abundance of supplies.
Mhm.
It's a formula that no one sort of knows how it's being. Someone I hope knows, but we don't know how it's being distributed.
Sure.
throughout
No
the state.
transparency.
Yeah, they're not telling us.
Okay, I have some more questions coming in. Here's a question from Arlene. Do we have any control over which vaccines we get?
Security.
My understanding is no. I mean, it's whatever the particular site receives. For example, CamCare, we know is giving Moderna. I know that, I'm pretty sure that that is what I'm going to be getting at Camden County. I'm not positive. I believe, Deacon, you are at another site.
Yeah, and Spira Medical Center had Pfizer.
Okay.
And let me just tell you that experience, just so you know, the state website does work. The major New Jersey portal that you mentioned does work. So I encourage everyone to register on that portal, regardless of what it looks like or what time they give you. I think it's a matter of luck. I signed up on a Tuesday last week, and Thursday I got noticed that I could get my shot at Inspira. So you never know how these things are going to work out. So get on that mega site for New Jersey's vaccine
So I
registration.
guess we should sign up a second time if we
Yeah, you
haven't
could-
heard back from the state.
Yeah, go
Well-
on it again and put your information in if
no?
you have to.
I don't think they
would-
want,
They'll kick back as soon as you put in your email address, it kicks it back and saying you're already registered.
Yeah.
Yeah.
it won't
Okay.
let-
Yeah,
Thank you.
I
for that.
tried that.
Yeah, okay,
No,
thank you. I was gonna do that, but I said, no, just be patient.
Yeah, no, I tried that.
Deacon, you really
Thank
got
you.
a quick response, but I did sign up one of my clients on the 21st. So what's today? 20, no, not,
26th.
yeah, the 26th, nothing yet from the 21st. So we're all learning as we do this.
Yes.
And as I learn more, I can certainly share. But we are definitely here to help you any way we can. Yeah, I'm sorry about Atlantic County, because I thought of Atlantic County. That's why we checked some of these numbers yesterday, and but do
Okay.
try the ShopRite's off hour and do put in the zip code for that particular ShopRite.
Okay.
Thank you very much.
I'm sure you're welcome.
Okay, we have some more questions coming in. Kathy, what is the difference between non-replicating and replicating vaccines?
There we go.
Non-replicating and replicating vaccines. I'm not sure. I can look it up. Anybody know? I mean, I wouldn't want to say off the top of my head without checking.
Kathy?
Centers for Disease
Kathy has
Control.
Kathy, you have the answer to that?
No,
Oh, if somebody has the answer, please do.
Oh, it's your question, Kathy.
hear me?
Yes.
Yeah,
Okay. The reason I'm asking that is because the two vaccines that are presently out are, I believe they're replicating. Johnson & Johnson is a non-replicating vaccine.
dose, double
I
dose.
believe they might have to do with the T and your B cells, but I don't know. So that's what I'm trying to find out. What is the difference between the two? And yes, I've gone and I've done my research, but I still am not 100% sure of what it is. So that's why I'm asking. I thought maybe, maybe.
Well, okay. And the only thing I can think of is, as I was reading more about this last night, I did read more about Johnson & Johnson. Well, they use a part of an inactive germ.
Right.
But there's a
Um,
viral vector vaccine from the adenovirus.
Yes, yes.
They're not
And
using the mRNA process.
no, they're not using that technology. And they're using part of that, which is similar to the cold and so forth, and introducing that. And it might have to do with how it goes into the cell, because it's a whole different mechanism when it reaches the cell, I believe, than the
Yes,
RNA. But I don't
In this-
know enough.
Yeah.
I'd have to look it
I
up.
don't know either.
In the South Jersey Times today, it tells you, they have an article about Johnson & Johnson vaccine expected by April, and they tell you how their vaccine works different than the other two vaccines that are out there. So if you go to South Jersey Times newspaper, it has the answer for you.
Great.
So that might
Thanks,
give you the
Frank.
replicating versus non-replicating. I'd like to look.
Yeah, well, it tells you how Johnson & Johnson's different from the other one, and it explains how their vaccine works in your system.
Good.
Wonderful. Thank you for
Okay.
that information.
Okay.
Thank you. We'll look that up.
Richard, you have a question? Did you want to ask? You're on
Yeah.
mute. Go ahead.
As I understand it from what you've said, once you've gotten your second shot and you're fully protected, if you were exposed to the virus, it will get into your body and your body will kill it off promptly. Is
Mhm.
that an accurate statement?
Yes. You
Okay.
can still contract it, but you will have no ill effects from it.
During that time, while your body's fighting it off, is it possible for you to infect someone else who hasn't been vaccinated?
Yes, it is.
I
Under the
believe
certain
that's so.
Under the certain conditions of being in proximity and being exposed to another person, yes, it can transfer to another person from you.
Okay, so you could pass it on to someone else. So you
That's why
continue-
the current CDC
Sure.
recommendations are, even after we're vaccinated, until the entire country is in a, as you've heard that expression, herd immunity, that we should continue wearing masks, social distancing, and washing frequently.
Yeah, but even with herd immunity, it sounds as though if there's someone who has not been vaccinated, they could contract it from you.
They could.
Mhm.
Yes.
But that's why we need to have close to 75 to 80% of people vaccinated before we reach herd immunity.
Yeah.
Okay, thank you.
Thanks, Richard. We have another question to be asked by Joanna. Johanna, welcome. You're on mute.
We go.
There she is.
That's good?
Yes.
Okay, go ahead.
I have a question because I know what I'm allergic for, but that are the things, I always tell my doctor. But what is in the injections, I might not be that if I am allergic to that. Especially, I know already that you have different injections going on. One injection different from another in another part.
So she wants to
It
know
might
how
come from-
she would know what she's allergic to if she
Yeah.
has
But
she doesn't get the
know.
flu shot
Yeah.
because she's allergic to eggs, so.
Well, there are no eggs in this virus. Okay,
Yeah.
no eggs in the virus.
But you know what is in the injection?
Yes, it is the synthetic mRNA. And then I mentioned the other ingredients. And all of this is wrapped in a lipid, like a fat type of thing. The other ingredients are, hold on a minute. The polyglycol, I believe. Give me a second to pull that out. The PEG, polyethylene glycol, and something that is similar to polysorbate.
means more than
Yeah.
And I can send that to you in the email.
Yeah, I mean, there
thank
are
you.
facts,
Thank you.
sure, there are fact sheets that go over the vaccines from the manufacturer and the full ingredients and everything.
I don't already
Yeah,
know.
because next week I have an appointment with the doctor. I'm gonna ask her. 'Cause she knows
Definitely.
me for a long time for if it would be good for me if I'm not allergic to any problems in the thing
Have
I'm
an
getting
EpiPen
into my
nearby.
arm.
Right.
Oh,
Yeah,
there-
speak to your doctor. That would be the best thing. Make sure
Yeah.
that she's aware of that. Have you
But
ever
I-
had another vaccine before? Have you ever had any
No,
vaccines in the
because
past?
I had asthma, and it's in Netherlands I have it very bad. But that is why I'm here, because I didn't have any problem here, but now it started up again.
Hmm.
So I have to
You
use
have
an
that.
inhaler pretty often.
Okay, well, speak to your
Yes.
doctor about that, just to be
Mhm.
sure. But
Yeah.
typically, if you've not had a reaction to other vaccines, you could feel pretty
Right,
safe that
yeah,
you're not going to get a reaction to
But what
this.
they hear, it sounds not very familiar to me.
Right, right. Okay.
Okay,
Yeah,
I do have one
okay.
other question coming in here. How long does the vaccine last? We
We don't
really-
know. It's all
We
brand
don't
new.
know yet.
Yeah,
It's too
No one
soon
knows.
to know, too soon to know.
yeah,
I don't know.
okay. That's
Go on,
to come.
That's why they can't tell us right now, if we are going to need a booster or anything else. And, it's just too soon.
Okay,
Hi, Ann. Frank and I are both registered with the state. He's a
Okay.
1B, I'm a 1C.
okay.
Does that really mean anything? Will we, Well, are they really going to contact us? Because that's what they keep, you know,
Right.
they send out their emails
I
saying,
mean, when we listened to the governor's talk yesterday, they had the person who was the head of the state saying that, well, you could always try your county too, instead of going into the New Jersey site. To me, that looks like this thing is totally mismanaged, that they're telling you to start calling all around, going to counties. So you question, how good is the big database that they seem to be making in Jersey then?
and your county kicks you right into the state.
It
What
does.
into the
county are
state
you in?
database.
What
So,
I'm in
county?
Gloucester County.
You're in Gloucester County? Can
Yep.
you travel?
yes,
Maybe we can help you with Cam Care to get in sooner, but the soonest shots are going to be, if it
At
was
the March,
Clemington,
yeah.
yeah, that would be April, no,
Like-
March, beginning of March, and then April, the second one. If it's Camden, maybe there might be some available for the end of March.
March.
that
So
would
we
be
can help
fine.
you
I mean,
with
that's
that.
better than, we're fine. I'm fine with it. I think Frank is too.
Yeah.
It's just that, you know, we don't know, when are they going to be in touch with us? When will they advise us as to when we have an appointment? So far, it's nothing.
When did you sign
Nothing.
up?
I signed up 2 weeks ago.
Yeah. so did
Okay,
I.
are you checking your emails closely?
Yes.
They send it
every-
to you, right? They send
Is
you an
it-
email. I mean, I got one that like they're out of vaccine, like,
Yeah.
and
Okay,
that, and,
Well,
you
we're
know,
out of it, folks. Too
right,
bad.
and just wait, like, so.
And just be sure it doesn't go into your trash or your spam.
Oh, no, it comes to me from the
Okay.
state. Yeah,
You
I've
totally
seen
Okay.
it.
fine. It comes right
Right.
in.
it's
So-
not- And plus
I
they can
think-
take, I said like you could send it to my cell phone too. So far, I haven't got a message to my cell phone because I said both ways, email and cell phone. You could
Well, we can
text,
help
but-
you with Cam Care. I think Cam Care is a good option for you. As long as you're able to travel, you know, some people can't go very far,
No,
but
we're
No,
perfectly capable of traveling. It's just that, you know, he's got his issues and I've got mine.
Right.
And, you know, if you're giving us such high numbers and letters or whatever, I mean, does it really mean anything? Or, you know, are they just yanking your chain?
well, I know that a lot of people just feel this sense of relief once they get both of their vaccines scheduled. And then much better after they start receiving the vaccine.
Mhm.
So
Well, I'm sure I would too, but in the
It's this
meantime,
time
it's
and-
very
yeah.
frustrating.
this is
Yeah.
the time that is very frustrating that, you know, we may
Oh, tell me something I don't know.
I would recommend, Frank, that you would use as multiple sources as possible to get a registration
Then I gotta
in.
go
And
chase
this
it.
is the natural course
So
of things.
so
Yeah,
we shouldn't have
State's
counted on the
the state is
doing whatever.
overflooded with a lot of requests.
Right.
They only have the one site. So I would recommend going to each county
well,
or
I'll
any
tell you
other
pers-
services listed and
I
try
tell you.
to get it.
I'll tell you personally, Jerry,
Yeah.
I'm getting to the point where I don't really care. I'm not running
Oh.
around to multiple sites and I'm not trying to schedule here or there to do that. Either someone's coordinating this thing the right way, or it's really a big screw up here to do it, where they're telling you to start going to counties and then check this
Well,
county.
I don't want to
check
make
that
any
county.
commentary politically, but I'll tell you what, this is kind of a good example. When you put the government in charge of things, this can certainly
Of
happen.
course. We all know
So we
that.
have a government that is in
Yeah.
charge of this, state governments, local governments, and this is new to people because they've never had such a mass request for any vaccine or any other procedure. So really, they're flying by the seat of their pants in many of these. They don't understand what they have to do.
I mean,
And it's
you
just
look
going to
at
take a
this.
lot of patience. And
Let it go.
I think what they're going to do eventually, from what I hear, is open up more walk-in sites. And it's sort of just like going to a restaurant. You know, if you have a reservation, you'll get your table quickly. If you don't, you may wait in line for an hour. And I think that they're going to be looking at that need to just have walk-in sites available for people. You will wait, but that's just going to be the normal course of things. Remember, that's how we used to do it in the old days when we all got our vaccines. We just sort of stood in line and waited and got
I
them. and
remember,
walked
I
away.
remember.
I have a feeling that's going to be what we're going to see because you're echoing what many, many people are echoing right now, Frank, is that it's very frustrating. There's just this coordinated form of registration coupled with a lack of the vaccine. You can understand where the frustration is coming from. Big demand, little supply.
Well, what do we do in the meantime to say, what are some of the techniques out there to bump up your immune system? while we're waiting?
I don't know, I take zinc every day.
Zinc, vitamin
That's been
B,
one-
and,
Vitamin B, vitamin C, and zinc is something that
Okay.
has helped people.
yep.
Okay, yeah, I'm on
And follow the
vitamin D.
precautions, follow the,
Mhm.
unfortunately,
We
We have the
do, we
big
do,
three.
we do.
Right.
And you can check with your doctor too, because my doctor actually checked my zinc and my um, vitamin D level
Mhm.
to see if I was under or low.
yeah.
Because you may not want to overdo it on some of the vitamins and things unless you really need them. But
Yeah.
people take zinc and vitamin D. Those are
Mhm.
two. I would check with your doctor and maybe consider a blood test to see where you stand, because some people are on the low end. And then, and just remember, we can help you. I hear your frustration. We can try to help you with where we have had success. And we get through. But it's like one place that is our go-to now.
They know it's good there. Mhm.
Yeah, it's good there for Camden
Yeah.
County, Gloucester County. It's just
Yeah.
one place that is our go-to right now,
That's it.
that is the quickest and most
Well,
receptive.
What do we do? What information do we give you for you
Just-
to, go in our stead to represent us in this thing? Or,
Well, Frank,
get us
if
an
you want to
appointment.
call me after the presentation, I'll get the information from you.
Mhm.
all
It's
right,
just simple things to give us the name, address, date of birth. So,
okay,
Okay,
all
thank
right.
you.
thank you.
Okay, we have a message coming in from Mary Burns. Suppose you have had the vaccine and are protected from COVID, but you have picked up the virus and are contagious. Do you have any symptoms or a way to know that you are giving the virus to others? That was kind of,
I am not sure the answer to that question.
If you've been exposed and you've been already vaccinated, the best thing is to quarantine yourself
Yes.
so that you just protect others. And that's really all you can do, is make an assumption that if you were in contact over 10 minutes with someone who definitely tested positive and there was not distancing or mask wearing, that you should consider yourself, perhaps you have it, and just quarantine as a precaution. You may not have symptoms after you've been vaccinated.
Right.
And this is the asymptomatic spread that they were talking about, that we have to always be concerned about, that can happen. So you may never know you had it, but assume maybe you did if you were in that kind of a close contact with someone who definitely tested positive.
yeah.
Okay.
Susan, did you have your hand up? Susan Bruce?
Yes. What was my question? I did hear Dr. Fauci saying yesterday that he kind of was recommending a double mask on the news, like a surgical one that you buy at the store, and then a cloth one for extra protection. Also, Leslie and I are parish nurses at Christ Our Light, and if we're helping people with the CamCare site, and because a lot of people don't have computers, and the number, what information would we need from the person if we're help signing them up?
Name, address, phone number, date of birth, what insurance, but you don't need the insurance, just the
Number.
name of the insurance. Did I miss anything, Ann? Is
No,
that?
that's it. Phone number? Yeah.
Yeah, and just keep in mind, they have Saturday hours till 1. And tonight till 8, I was going to test that out, see if I got hold of anybody.
Yeah.
Okay. And did you have another part of your question? Was that?
I just wanted to say, don't give up. My mom actually passed away a week and a half ago from COVID. And my dad, he's 90 and he got it too, but he's doing pretty good. He's on his way to recovery. So I don't want anybody to give up. My mom had severe COPD, so just keep trying and you'll get on.
Thank you for that, Susan.
Thank you for
for that
sharing.
encouragement and sharing.
Yeah.
Yeah, I mean, you do have to be persistent. I know, it's so hard.
John, did you have a question?
Yes, I'm not sure if I heard it before, but I'm down in Atlantic County. Can you go to other counties out of your county to persevere in these websites and get your shots in other counties?
Seems that's what people are doing.
Well, I think it depends on the site. I know
Yeah.
in Camden County, CamCare will take Camden County and Gloucester County.
Okay.
So yes, if they will register, if you can register on that site, I would go for it.
Yeah.
And so, I know that in the past, when I was looking, I don't know, Atlantic County, maybe Cumberland would be closer to you. I know that it was rare, but occasionally something would open up in Millville at the shop, right? Okay, or Bridgeton. And the other night, I was just poking around, and I did see one, like there are cancellations. Just keep that in mind. I saw a cancellation for one of the ShopRites too. Okay? But it had to be a cancellation because it was like one day and everything else was blacked out. Nothing was available. So it had to be a cancellation.
And just be aware of the way the state has done this. It's not by where you live. They say, get a vaccine near where you live or work. You could always say, I volunteer or I do some activities up in any other county. You can get a vaccine anywhere in the state. So don't be specific to your address. Go to any other website you might feel that you have, at least you can get there. That's the main thing.
Thank you.
Thank you. I have two comments here, one from Kathy. Keep up your safety precautions because after the vaccine, you still have to keep up the safety precautions. And yes, thank you for that, Kathy, for reminding us about that again. And MJ, Mary Jane said the vast majority of seniors have low vitamin D levels, which have been demonstrated through research to have a very positive effect on bone strength, immunity response, mental. It is best to be evaluated for levels and have your healthcare provider establish a dose for you and to monitor. Meditation and prayer are also enhancing immunity. Yep.
Thank you for that. I know that my brother had a low vitamin D that had to be treated. So that is definitely something that's out there, and those levels will help you to know, definitely. Thank you.
Anybody else?
Yeah, I have. When you say CamCare, do you mean like camcare.org or what's the whole address?
Okay, well, we're going to be sending this out. Let me see, I'm trying to see who's speaking right now.
It's camcare.net.
Oh, .net, okay,
Yeah.
thanks.
But you cannot make
Okay.
appointments online for that,
You have to
Right, okay.
call, and we'll give you
that information.
that information.
Okay.
I don't know if you could hear me. I was
Freeground,
muted.
yes.
Hi, can you hear me?
Yes, hi,
Yes.
Teresa.
Oh, hi. I was muted. I have two questions. One, someone said that you should take an aspirin before you get the vaccine. Have you heard anything about
I
that?
just, when I checked on the Centers for Disease Control, the information that I read was that you should not take any medication that would be anti-fever or anti-inflammatory.
Oh, okay.
I would put aspirin in that category, Advil, Motrin, Tylenol, because it's just not known how that affects the immunity at this point. There's just no information known.
Okay. My second question is, if you miss your second shot, if you're sick or whatever, what
Yes.
happens then?
Okay, you can, the Centers for Disease Control recently gave information that you can get the shot up to 6 weeks from the first shot, or 40 days, okay?
Okay.
However, I'm not sure how that'll work with scheduling, okay? That, once you get your shot scheduled, depending on where you get your shot scheduled, it's a matter of getting back in touch with them to get the next vaccine scheduled.
Yeah.
Okay? And we're already having issues now, so I'm not sure how that will work, but you really should try to never, of course, miss
Right,
that.
right. No, I'm just saying in case somebody gets
Yeah,
sick. or
you
whatever.
have up to that amount of time.
Okay.
And what I read on the Centers for Disease Control is that they're not recommending that you start the cycle again if you you get the shot after like even 6 weeks. They're not recommending that you start over again. So, I mean, there's just not enough information known to answer every question.
John, did you have another question?
Just in conjunction with what the lady just asked with the aspirin, you mentioned before, Mimi, that some of the side effect could be fever. If you do get a fever, do you recommend taking Tylenol or something for that, or don't take anything?
As far as I know, afterwards is fine, but it's
Afterwards, okay,
pre-medication.
right. That was
You
my
should not
question.
take it in, that's my understanding.
Okay,
Mhm.
thank you.
You're welcome.
Susan, did you have another question? Is your hand still up? Susan Bruce?
Oh, yeah.
I must have forgot to put it
Oh,
down.
okay. Okay, no problem. Anyone else?
Yes, hi.
Hi.
Hello, I'm Mary Sharon Monica with my husband Lonnie. We're from St. Stephen's.
Hi.
And first of all, I want to thank everyone for this Zoom presentation. It's very informative. You answered one of my questions. I didn't realize that you could register at various sites. So thank you. And also the shingles, the other vaccination, I'm due soon for my second shingle shot. So I'm understanding not to get that until after I have both vaccines, both doses of the vaccine. Is that correct?
Well, the recommendation is not to get it within 14 days of the vaccine, of the COVID vaccine. So if you can, now, I'm not sure, because we have the 28 days in between.
I would just
I really
not get
didn't
the
read it
second-
that way. You know what? I have to look back on the site for the Centers for Disease Control. I can look that up for you if you'd like.
Why don't you call wherever you got your first, did you get your first shingles already?
I did, yes.
All right, I would just call that doctor, the primary
Yeah.
doctor who is working with you and pose that question so that he understands or she understands that there may be a gap and how long that gap could be for the second shingles vaccine. Have you had your first COVID vaccine?
No, I have not.
Okay.
Is
Oh,
it
okay.
scheduled? Is it scheduled?
No, we're registered at the mega site, but it's
Okay.
not scheduled yet.
Okay.
Well,
Okay.
chances are, unfortunately, it may not happen real soon for your COVID shot. So I would ask the doctor about maybe getting your second shingles. So at least you have that protection in you. After 14 days of that second injection, you would be eligible for the
After-
first
after
COVID
14
vaccine. So
after
I talk to your doctor, see what he recommends.
Thank
Yeah,
you.
All right, yeah, just to see. I thought
Yeah,
you already
that's-
had your first COVID, so that would be a little bit.
No.
Okay.
No. But, and again, thank you, everyone, for all this information. First time we're on Vitality, Zoom, anything, so I appreciate
Well,
it.
welcome.
Welcome. Hope to see you back again.
You will.
Does anyone else have any last minute questions or concerns? Like I said, Mimi has stated that I will follow up with an email with some information. Again, we're here for you. If you have any additional questions or concerns, you can reach us on our helpline at 888-268-4825, and I'll send that information also. Deacon Jerry is going to end our presentation with a blessing. And it's been great seeing everybody.
Okay.
Deacon Jerry?
And again, thank you, Mimi, and thank you, Ann, for working with us on this, and my staff who's here. Thank you for participating as well. And for all of you, I appreciate your time and effort in spending it with us today. And I hope that the information has been helpful for everyone so that you can try to get through this, as we say, get through it together, through the frustration. Frank, we need to find out who the patron saint of patience is, and we'll just keep praying to that patron saint of patience and persistence, and I'm sure we'll get there at some point.
Yeah.
But let us now pray for all those who have been affected by the virus and pray for their well-being. So in the name of the Father, Son, and Holy Spirit, amen. Lord Jesus, you heal the sick. We pray that the coronavirus that has affected so many in our world can be contained, controlled, and cured. We lift up to your mercy all those affected, all those working hard to study and cure this illness, and for all the healthcare professionals and emergency management teams that are working day and night to keep us safe. Help us, Lord, to trust in your merciful care. Our Blessed Mother, pray for us. Saint Joseph, pray for us. And Lord Jesus, hear our prayer. And may the Lord bless you and keep you. May the Lord let his face shine upon you and be gracious to you. The Lord look kindly and give you his peace. May the Lord bless you always. In the name of the Father and the Son and the Holy Spirit. Amen.
Amen.
God bless you all and thank you. We'll stay in touch.
Thank you so much, everyone.
Thank you for
Thank you.
everything.
Bye,
Welcome.
guys.
Thank
Okay,
you very
Thank you.
Thank you.
Thanks, guys.
Thank you all.
Thank you all.
Thank you.
Thank you.
Thank you all.
Bye-bye.
Bye.
Good to see you.
Thanks, Anne Marie.
Bye-bye.
Welcome.
Oh, bye-bye.
Thank you.
Okay, let's see.
I know
Well, yeah.
her.
Yeah, hi. Okay, good.
Yeah.
Hi,
Right.
Joanna. How are you?
I am fine, thank you.
Yeah, you're looking beautiful as ever.
She is. She is. She's doing very well.
This is very interesting for
I'm
me.
so happy you were here today and join us.
Yeah, I do.
You look
Oh, yeah.
beautiful in that color.
Oh, thank you. Yeah, I try to use
Yeah.
more lighter colors.
Yeah.
Sometimes if you black, you know,
Yeah.
but I like lighter colors because I am old.
Oh, she's old. She's not
That
old.
blurs me up a
She's
little.
not old.
You're only 100.
You're a baby.
God bless you. Take care.
So sweet.
All right, bye-bye.
Okay. Ann,
Bye-bye.
thank you so much. It was
Yeah,
a wonderful
nice to see you.
You're
presentation.
welcome. You're welcome.
Okay.
Here,
Bye-bye.
Wendy, Carrie,
Bye-bye.
Bye-bye. Take care.